Presenter today. Our presenter is Jose Juan Lara. He is the Systems and Advocacy Senior Program Manager from the Asian Pacific Institute on Gender-Based Violence. So, Jose Juan?
Hi, everyone. Good morning or good afternoon, and welcome again. For those of you who are coming back or have been participating in the previous webinars of the series, welcome back. For those of you who are new, welcome. So I'm going to go ahead and share my screen. And hopefully everyone can see my screen. Kathy, thumbs up on the screen.
Yes.
Thank you, everyone. So again, welcome. My name is Jose Juan Lara Jr., and I am with the Asian Pacific Institute on Gender-Based Violence. For those of you who are new, joining us for the first time in this webinar series, the Asian Pacific Institute on Gender-Based Violence is a national culture-specific resource center on the intersections of gender-based violence as it impacts or affects community members who identify as part of the Asian American, Pacific Islander, Native Hawaiian, Middle Eastern, North African communities. We share that title or designation as a National Culture Specific Resource Center with a handful of other organizations such as ourselves that are specifically and uniquely situated to respond to other communities of color or specialized or communities not of center. And the Asian Pacific Institute on Gender-Based Violence has been around for many, many, many years. And just generally speaking, all our services, all our training and technical assistance services are accessible to anyone here. I specifically am part of the language access team. Our project is called Interpretation Technical Assistance Resource Center, or ITARC for short. A little bit more about myself. I've been doing this work for 25 years. I started off as a legal advocate in the crisis center in my hometown of Brownsville, Texas. And then moved to Austin, Texas to do some statewide work with a statewide legal nonprofit. And then from there, about 8 years ago, started doing national training and technical assistance, specifically with culturally specific organizations and so on. And of course, the broader service provision fields, criminal justice, mental health, and so on. And so this webinar series has led up to this point in the conversation. First, we started off talking about contextualizing language access from a perspective of being inclusive of all modes of communication and linguistic diversity, language access as a human strength and practice, language access as a trauma-informed practice, language access as a practice that changes the physical environment for communication to happen, and ultimately language access as a systems change approach, which is tied into today's conversation. And then the second session of the webinar series, we were able to have a presentation from my colleague, Tomiko, who talked to us about the differences between the role of an interpreter and a bilingual advocate or a bilingual service provider, which is very different, and understanding our roles and our accountability, our ethics around what we each do and contribute. And then yesterday we had a session where we engaged in conversation with two amazing advocates, Sabrina Rout, who is the executive director of DOVE, a local organization in the state of Colorado that is by and for survivors who are deaf and hard of hearing, and also as well as Liam Esposito, who is a national TA provider with Activating Change, which is another national resource center specifically providing training and technical assistance around how to work with survivors who are deaf and hard of hearing, as well as they may have some form of disability and so on. And so now we're here today to kind of put all those things together into what we call a language access plan. And I would encourage people to ask questions in the chat. I think we're a small enough group. So if you do have any questions, please put them in the chat, and someone from CCASA will interrupt or interject and say, hey, Jose Juan, there's a question, there's a comment, what have you. So we'll start off with asking the question, what is a language access plan? And so basically, a language access plan is a strategy to assess, identify, manage a system to ensure that survivors who are limited English proficient or use different modes of communication are enabled to access our services holistically without any barriers or minimal barriers or challenges to do so. We'll talk more a little bit about that. And there's a whole entire process and a practical approach to this, but this is basically what a language access plan is. And so for this particular webinar, I'm going to approach it as I would do a technical assistance consult. Like, let's say one of you would reach out to us, we set up a meeting, and then basically going to go over the process of that, how that would look like, okay? And just like anything, anytime anyone approaches us with needing or requiring assistance on how to develop a language access plan, it is a thought partnership. We work with what you got. We work within the constraints or confines of what you've done or want to do, and so on. So I just want to put that out there. But again, a language access plan is a strategy to assess, identify, and manage a system to ensure that survivors who are limited English proficient or use different modes of communication are able to access the services that you provide in your organizations with as minimal barriers as possible. So you're now at the point where you've reached out to API GBV, you're talking to me and say, hey, Jose Juan, I've been assigned or delegated the duty to establish a language access plan for the entire organization, right? And part of that is a lot of stress, a lot of pressure, a lot of anxiety. And that's quite normal. And I'm here to tell you, you're not alone in this process. And so we start off with the unsureness of the situation. It's like, I don't know where to start. I don't know what a language access plan is. I was just told, and now I have to do it. And a lot of times, the reason an organization, beside that it's federally mandated for organizations such as ours to provide linguistically accessible services and have a language access plan to help with that process, is really not knowing where to start. And so for us, it's kind of asking questions back and forth. And again, trying to ease the anxiety around the process. We welcome questions. And sometimes we may have more questions for you to think about, because my entire purpose as a technical assistance provider is to help build the capacity for your entire organization to make sure you're linguistically and culturally responsive and accessible to survivors from diverse communities, regardless of their ability to speak the language, which is English here in the US, their different mode of communication, how they identify, and so on. So we start out with being unsure. I don't know where to start. That's fine. And it starts off with a conversation. And part of that is getting to know each other. Again, part of a thought partnership is getting to know who I am, who I'm having a conversation with, getting to know who the organization, who you serve, because we've done this process with multiple organizations, different organizations, from community-based, systems-based, culturally specific, mainstream, nonprofits, organizations, state agencies, local municipalities, law enforcement entities, and so on, right? Multi-social service organizations, and so on. So just having a conversation. What is it? What is it that you're hoping to accomplish? what is the motive or impetus behind you now needing to provide a language access plan? And if we're honest, usually the reason is because it is tied to funding. It is a funder requirement to have a language access plan. Someone got sued in the state, or someone died because of negligence on behalf of whatever entity was there to provide the service because due to lack of language access, right? And so we're going to be honest, is like getting to know the situations. The other part is working on developing a plan, which we'll go into it in a bit here. But there is a step-by-step process that has been developed over the years through trial and error based on response from community and community telling us, as well as research, right? Because everything we talk about here is not only anecdotal, it is also research-based. And then some of you here in this space may already have a language access plan. And so now you want to take it to this next level, right? Because just like any document that you have in your organizations, like a standard operating procedure for personnel policies, hiring practices, and so on, it's a living document. It has to be updated every time, maybe every year, maybe every other year, especially when you are providing services. So organizational assessment is part of this conversation, which leads into developing a plan. Whether it's already existing and wanting to enhance it and be reflective truly of the linguistic diversity in your community or communities, because a lot of us serve multiple jurisdictions or multiple, maybe statewide or nationwide and so on. We've implemented a plan. Maybe you've already implemented a plan, but you discovered, oh, maybe this is not really how it should go, or maybe you implemented a plan without really building into the critical thought process of why, right? Because sometimes and this has been some of my experience working with some organizations, is that they implement a plan without really checking in with the frontline staff or community or whomever. And then now you have this new directive as staff of the organization, regardless of who you are and what type of service you provide. And you're like, well, when did this change? I didn't know we could do this, what have you. And then the other part is have implemented a plan and are looking to enhance it, right? And as I've already mentioned before. So this is where we start the conversation. I'm unsure. I inherited this project. And where do we go from there? And so we start off with some basic questions that we kind of have developed over the years. And so these are things that you have to ask yourself, or we ask ourselves when we do our TA consult. It's like, if you as an organization are thinking about what is language access and are we doing it? Are we providing culture responsive and linguistically accessible services for inclusive of different modes of communication? Is asking or making statements like, when you are organizing events, are they only monolingual English only with no option for interpreters? You might not have a language access plan. Asking bilingual staff to interpret and translate in addition to their job responsibilities, you probably don't have a language access plan. No formal arrangements are in place to hire competent interpreters and or translators. Because as we learned, for those of you who attended the webinar on working with interpreters, there is a different skill set because not all interpreters are translators, and not all translators are interpreters. It's a different skill set. And some, on occasion, you may have an interpreter that is is skilled in translation of documents and vice versa. But again, how do you do that? Staff are turning away participants or community members that are limited English proficient in training or events, or worse, from services. And I repeat this again, and I've mentioned this in every webinar. What we do, regardless of your title, role, profession, field of practice, what we do when we encounter survivors of sexual assault or gender-based violent crimes, we are providing life-altering, life-saving services. And if you're turning away survivors because they're limited English proficient or used a different mode of communication, you may not have a language access plan. Or when you look at everything that you have, every point of access to information of your services, whether it's online, social platforms, written, what have you, you have no translated materials or just using Google Translate to help in the communication or translating information. You may not have a language access plan. And then the other point of this conversation is asking culture-specific groups that are multicultural and multilingual, perhaps, to act as your interpreters or translators when survivors, community members who are limited English proficient are attending or trying to access your services or are at your organizations or agencies. Again, when we start out the conversation around language access plan, these are the kind of things that I, as a TIA provider, kind of look for and ask for. And that's okay. And if you're saying no to all these things, or if you're saying yes, this is happening, or no, this is not happening, it's okay. You're not by yourself. Like I said, it is a process. It takes a while. And developing a language access plan is a paradigm shift. It's a paradigm shift. It's not just the responsibility of in what I've seen, and also my colleagues in the language access team have seen, is that often this is delegated to the bilingual advocate or the bilingual professional or service provider and the agency. Here, now you're responsible. No, they are not. Perhaps they're there to lead the process, but it's the entire organization's responsibility, from board to executive leadership to whoever does your finance, your volunteers, direct service staff, mid-management, whatever. Everyone in that organization has to be accountable and has to practice and put into practice and implement the language access plan. Period. There is no argument to that, because if as an organization, from top down and bottom up, there's a problem, people are going to end up getting hurt. Your organizations are opening yourselves up to losing funding, getting sued. And of course, the ultimate consequence to that is someone dying because we are not prepared to provide linguistically accessible services that are also culturally responsive. And so it's a floor to ceiling approach, right? And we build up from where you're at and then hopefully move up, right? And again, in our approach, working with organizations or entities around developing and implementing a language access plan is looking where you're at. What's the level? And it is a delicate balance, right? To make sure that everyone that comes to your front doors has access to those services, regardless of their linguistic ability or mode of communication. And without imposing an undue burden on the agency and organization as well, right? And so it's a balance. Because again, we often, when we are providing services to survivors of sexual assault or gender-based violent crimes, it's usually in a moment of crisis, right? And just to give you a hint, this is nothing new. A language access plan is just another way of saying safety. It's part of your safety planning. It's part of our safety planning, right? The floor to ceiling approach is the level of language access that an agency or organization must provide depends on a demographic assessment of its service area and the most commonly encountered languages, which we'll talk a little bit more about that. The other piece to the floor to ceiling approach is developing a proactive plan that addresses the needs of individuals who are limited English proficient or deaf or hard of hearing or use different modes of communication. Again, is from floor to ceiling. And often when we talk about the floor piece, is that you and your organization may use already language line, which what we call the language line, or telephonic interpretation services. You may have hired bilingual and or bicultural advocates or service providers, frontline staff in your organization, or offering translated materials, right? And in the grand scheme of things, that is a bare minimum to providing linguistically accessible services as part of your overall language access plan. Because when I ask organizations or representatives of these organizations, when I ask them, do you have a language access plan? Or even when I'm doing a training, people will say, well, we use the language line and we have bilingual staff. I was like, great. That's a part of the language access plan, but it's not the entirety of the language access plan, right? The ceiling is right using the in-person interpreters, establishing co-advocacy partnerships with community-based service providers. With the caveat to this point is that they're hopefully multilingual and multicultural, right? Culturally specific. And establishing a language access bank, right? Which again, these are things that we have experience providing technical assistance and training to organizations. So again, you know, we can help you develop those things and how do you begin and how do you start? Again, when we talk about developing, just starting to develop a language access plan is determining the floor to ceiling. What is it, where you are at in that process, from the floor to the ceiling, where are you at in that flow chart or what have you? And again, like I said, you all maybe on this column on the floor, and that's fine. It's a start. And to acknowledge is that you are doing something. But now let's make it, let's expand that. Let's make sure that part of that, and we'll talk about this, but having a successful or having a proactive language access plan or providing linguistically accessible services is based on meaningful collaboration, and we'll talk more about that. Kathy, I'm going to pause here to see if there's any comments or questions in the chat.
There aren't any questions right now, but if anyone has any, please put them in the chat.
Thank you. All right. So this particular conversation is quite, I'd say it's probably the most boring part of the entire conversation because we are actually going to go into a step-by-step process of what that looks like of developing and formalizing and implementing a language access plan. And so these are some of the steps that from when we've had initial TA consult, it's like, okay, now where do we go from here? So we start with convening, assessing, collaborating, developing objectives and / time frame of when you want to implement the language access plan, who will implement, funding, money, right? Formalizing, implementing. There has to be a time for capacity building on how to formalize and implement the language access plan. Outreach, and I would say specifically around community outreach and also include community engagement, as well as monitoring and compliance. So these are the steps on how to develop a language access plan. All right. Just like anything else, just like before we start, is really kind of determining, you've spoken to me, I've downloaded you with a lot of information. And one of the options or one of the recommendations we always offer is, besides you, who else in the organization is helping support this process, right? So we always recommend go back and talk to your leadership, give them the breakdown of all we've given you, just initial information, But one of the things we always recommend is make it as a group effort. Because there's a saying that goes, teamwork makes the dream work, right? And that's kind of a hokey thing to say, but really it's not just one person that can do this. Because we know in the work that we do in crisis intervention work, there's a high turnover. And so when people leave, that institutional knowledge leaves with them. That's why you have to memorialize your linguistically accessible process of your services. That's why we have a language access plan. But you have to make sure that it's a group effort. And even though you may have identified a group internally to help take the lead in this process, again, it's still everyone responsible for this conversation, for this plan of action to be implemented and formalized as part of your routine daily process. And when we do that, when you make this into a group thing, and some of you may already have groups develop, internal teams, work teams in your organizations that kind of issues or barriers that community members are identifying to access your services. This is just one thing to add to that, right? And fold it into that. Because when you are convening internally and have identified this solid group of people that, and it also depends on the size of the organization, right? Perhaps you are a multi-social service organization that serves statewide or regionally in your home state, and you have different directors or supervisors or managers. They all have to be represented as part of this work group. Because it also creates a sense of ownership and agency, right? It also, when we convene as an internal work group, it drives the development and implementation of the language access plan. It sets the tone. And it also, the work group provides insight and access to staff members and their varying work roles. Like I said, some of organizations are multi-social service organizations doing many things, and you may have programming that addresses or supports or advocates with survivors of these form of gender-based violent crimes. Or you're a sexual assault standalone crisis center, or maybe you're a dual, or maybe you're an adjacent service provider like a prosecutor's office or what have you. And the recommendation is the same. We recommend to have an internal group that can help promote and move forward this process. But there has to be leadership support. If you happen to be a multi-social service organization, I would say there has to be leadership represented in that as much as possible. And yes, we're all busy, but again, we can never be too busy acknowledging and understanding that what the services we provide are life-altering and life-saving. That's it. And so part of that, the next step of making sure that there's a group, you've convened a group, you formalize it, you set up some parameters, or perhaps you're adding or you're folding into an existing group that kind of helps address some of these challenges around accessibility or what have you. It's really just identifying internally first, or I should say externally, the linguistic diversity of the communities that you serve that are existing in your service area or areas. The number or proportion of individuals who are limited English proficient or deaf and hard of hearing who are eligible to be served or likely to encounter your program or services. And the question is, who are the community members, participants in the service area you serve? And you may be thinking, where do we start? Just like anything, start internally. Start doing an audit. And I know that word can be scary for some folks, but look at your grant reports. Look at your quarterly reports or monthly reports or whatever cycle of reports that you submit to your funders. what are you seeing? What are the patterns around who is accessing the organizational services? Um, and again, some of you are regional or statewide or serve different multiple counties or communities. That may vary, but you have all that information already. So look internally first. Look at what your grant reports, your demographic data that you're collecting. Um, and it'll tell you a story. It'll tell you a story because the other thing connected to mission, because this is also connected to the mission of the organization. And in a lot of our organizational missions or vision statements, it says loosely or generally speaking, it says we serve all types of survivors. Are we though? Are we, right? And so that information you can easily get internally from your grant reports, your data reports, looking at that. Who is missing? Who's not coming to the organization, and so on. So you start with that, start internally, and then moving externally. And you can get this information through census data. You can get this information from hospitals, schools, your local municipalities. Because as some of you may or may not know, any organization or entity, department, what have you, that receives any type of state or federal funding, you are required to provide linguistically accessible services, which means having a language access plan. And or if your organization provides life-saving services, you are required to provide linguistically accessible services and have a language access plan. And again, you can get that information, that external information on assessing the languages that are spoken in your community through census. And, you know, I this morning, I was kind of curious to find out what is the linguistic diversity of Colorado. And there's plenty of websites out there. If you just go on Google and just put statistics on LEP or limited English proficient community members, Colorado or your city and the state, what have you, you can find that information. It's out there. But once you've done that, once you've kind of done an assessment of the linguistic demographics of the population, the communities that you're serving or want to serve, because historically they have not been able to access the services of your organizations, it's just doing that, just doing an assessment, just like research basically. And then you may say, but Jose Juan, we have so many languages spoken in Colorado or in Denver and whatever community county you live in. It's like there's just so many. What do we do? We'll narrow down your scope, right? And what we usually recommend is start off by identifying the top 3 and or the top 5 languages that are spoken or modes of communication used in your service areas, other than English, of course. But this also may be complicated a little bit more because, you know, what about languages of lesser diffusion? And so a language of lesser diffusion is a language that is not commonly spoken in your community, perhaps. And the biggest example to that would be, let's say you have a community of people from some part of Latin America, specifically from an indigenous Latin American community who speak Mixteco, right? And that is a language of lesser diffusion. But in some pockets of some states, like let's say, for example, California, there are significantly big pockets of community members who speak Latin American indigenous languages like Mixteco, where there are community-based organizations that have developed and do provide support in interpretation and translation. But simply, again, do go and do some research, identify the top 3 and or the top 5 languages, and maybe within that scope, maybe you also might want to include those languages of lesser diffusion, right? But of course, just like anything else, when it comes to stats, statistics, and research data, it is limited by how the question is asked, and who's asking those questions, right? And so sometimes that data may be not a true representation of the languages that are spoken in your communities, right? Especially those languages of lesser diffusion. But again, it's a start. Maybe identifying the top 3 or the top 5 languages that are spoken in your service areas. Just looking at time. And then part of that is identifying current language access practices, right? As already mentioned before. So these are the top 3 languages that or top 5 languages we've identified in our service areas. So now, are we as an organization really able to provide linguistically accessible services to them, right? And again, a lot of this information builds on repetition, but it merits repeating, right? Assess how you are currently serving speakers of languages identified in your assessment of the linguistic demographics, right? Look at your current language access practices. What do you currently have in place? And how are you providing services to individuals with limited English proficiency or deaf or hard of hearing? Again, if when we meet and I ask you the question, do you have a language access plan? And you tell me, and you're in the floor stage of the process, that, well, we use Language Line and we have bilingual service providers. Okay, well then so let's start with the bilingual advocates in the example I want to share. What languages are they primarily are proficient and fluent in speaking? And if you're telling me Spanish, and usually Spanish is always the top in the top 5, great. But what about these other 2 or 4 languages that you identified that you want to provide access to? And again, part of doing an internal assessment or organizational assessment is surveying your staff, your team members from top to bottom and asking them, in your direct service, have you encountered these languages, right? And what's been your experience? Again, you may have already the answers, but it's just not flowing up the chain. Part of this process, of course, is formalizing the plan. So you've gone and you've met with us, right, with me or one of my colleagues at API GBV Language Access Team. We've downloaded you with lots of information. You've met with your leadership, maybe your immediate supervisor, who then maybe takes it back to the CEOs or whatever executive title that they may have. And now we've met again, and it's okay, great. So we've formalized a group. There's a representative of each division, program, department, what have you. We've defined the roles, what we're supposed to do, all of those things, right? We've done an assessment. We've done an assessment of the organization. We've surveyed the team members, frontline staff, everyone, to see what is their understanding around our linguistically accessible services. Do they understand what that is, and so on. And then we've also surveyed, the community and asked them, because that is part of the process. You've asked them, and we've also, based on the census data we've collected and so on, all those things. So we have all this information. Now we need to formalize it, right? And how do we implement it? So before anyone panics, there's plenty of templates out there that you can use and you can download that can serve as a skeleton or a boilerplate template to kind of help you build or built into that template, right? So don't panic. We can connect you, or we can offer you that or refer you to those links. but but the next step is to formalize the plan, right? And formalizing the plan is a directive that sets the standards, goals, and expectations of an organization on providing accessible services to limited English proficient participants and or community members that use different modes of communication. That's it. And then this template, this form covers from policy language around the practice to may have a section on the training you're going to give to staff around how to do a language access plan or how to provide language accessible services and so on. So it is a step-by-step, very comprehensive, and it's also adaptable to your circumstances, right? But again, formalizing the plan, it is a set of directives that sets clear policy and practice and the goals and maybe long-term expectations as part of that, right? Because the language access plan also sets, let's say, for example, in 2 years, we're going to increase our pool of bilingual direct service staff from 1 to 2 people, right? And because of the languages we've identified, it's not just only going to be Spanish, but also maybe it could be Mandarin, perhaps, because that's usually the one always in the top 5, or whatever other language. And maybe if you're really courageous, we're going to also include a language of lesser diffusion, an indigenous language, let's say like Mixteco, because that also sets the goals, right, for the organization. The language access plan does. And just to give you an example of some language that would be included in your language access plan, it plainly states, it is a policy of this agency organization to provide timely and meaningful access to limited English proficient persons to all agency programs and activities. All personnel shall provide free language assistance services to LEP individuals whom they encounter or whenever an LEP person requests language assistance services. All personnel will inform members of the public that language assistance services are available free of charge to LEP persons and that the agency will provide these services to them. Again, this is just some sample language. That's usually kind of boilerplate language that a lot of the language access plans include. Again, it's an example. But you can see, based on this directive or policy language or practice language, it's very clear. Shall provide, will inform, right? There is no, well, maybe only in these instances, like, no, we shall and we will, right? So which means that you also have to engage community in preparing for that to happen. Implementation, which of course, once, and so part of the actual stage of, when you're in the stage or the phase of, you have the template and you're adapting it to your circumstances and so on, you've collected everything, you're doing that, there's always a back and forth, right? So part of that TA process that we would do with you is we'll look at edits, we'll ask you questions. So it's a back and forth editing process, right? But at the same time, we're also building your capacity. So now you're at the point of this conversation around implementation. And of course, I'm kind of skipping a lot of chunks in this, but I'm just giving you a basic rundown of the process. Now, just because you started off with an internal group that's helping take the lead on these things, right? It doesn't mean that they're going to be automatically the ones that are going to be responsible for all these things to happen, right? Because it depends on the structure of your organization, how big, if you're a multi-social service, or even if you're, even within smaller crisis centers, you may have multiple programs and so on. So part of implementing is also identifying which people on staff will take responsibility for what tasks to happen. right? So from the moment of census data collecting, which includes internal surveying, community members, all of those things. And some of you may already be doing this. For example, a lot of crisis centers have do client satisfaction surveys, right? So it's maybe just a matter of asking in that form, like, were the services accessible to you, whatever. But again, like, teamwork makes the dream work, right? Um, and so responsibility means that from the board, as part of the budget for each year, you're going to include an eye item for fundraising for this particular service, right? Because it does take money, and I get that. But it has to be a priority of the organization, which comes from the very top to the very top. Also, responsibility of tasks is your finance people, the finance person, right? Because they need to understand when we have this particular monies, and they're assigned for to contract with interpreters or hiring bilingual service providers or team members or translation services, right? Because I've worked in situations where, or heard of situations where, there's a disconnect from the finance team to the direct service team, and like, why are we doing this? And this is going to cost us money. Like, need I remind you that we are providing life-altering, life-saving services, and unless we want to get sued, we're going to work it into the budget. Opportunity to include a glossary of language access related terms, i.e. meaningful access, video remote interpretation, interpreter translation. Again, so within your language access plan, you will identify who are the people in case this happens from this team, this team, this team. Interpreter and translation. So again, part of the language access plan is including a glossary of terms. So that way everyone understands when we say VRI, let's say you're doing an inter-organizational referral. And we all love our acronyms and abbreviations. And within that, if you say a client came in for housing information, they declared that they're a survivor of sexual assault, referring them to you, they may require VRI. And you as the SA advocate is like, what is VRI? And if you look at your language access plan and said, oh, video remote interpreting, I got that. Again, and so on. Opportunity to identify additional policies you want to include in your plan. And again, like I said before, your language access plan is a living document that has to be looked at every so often. So we can make sure that it is truly responsive to the linguistic diversity of your communities that you serve. Again, implementation. Staff training, I've mentioned this briefly, but you have to train the staff on the language access plan, right? It's not just a matter of here, this is another document added to the pile. Because let's be honest, how many of us, when we first get hired, we really read the personnel policy handbook, we sign it off in agreements to everything. Like, I'm guilty of that. And honestly, how many of us actually read whatever other policy or handbooks that we get at the time of point of hiring? Do we look at them? It's very important. So again, you have to build time to staff everyone on this plan, where you can find the language access plan, who do you contact if you need interpretation services for a survivor, community member, participant, and so on. So basically, now that your plan is developed and policies, protocols, and procedures updated, make sure that your staff is familiar and trained. I've had situations where a jurisdiction did all these things. They implemented a language access plan and they just said here, but then people didn't really know how to manage that. It's like, well, I don't know, and you're asking us to do this. Like, you have to build capacity. And part of it, again, part of your language access plan is community outreach and engagement. How will you notify the communities that you serve that are limited English proficient or deaf or hard of hearing of their rights to language access and the services you have available to them? And so the example I can give to that is, let's say that as part of your language access plan, you are going to translate your website. You're going to have an option where click here for Spanish or something like that. That's great. Wonderful. But now that you've trained your staff on the changes to the website, do they also know how community members can do that? You know, and when when you direct people to the website for information, or when you're doing your community outreach and engagement presentations around your services, are you explaining the process for that? And when you say click here for Spanish, is that tab in the language that you want people to access, right? Because if you have here, as I click here for Spanish, well, you're assuming a lot around that. And so again, and also literacy levels as well. So again, you can see that language access planning, you're building in also time for community outreach and engagement, because you want to make sure, again, that everyone's on board, that you have a strong foundation in this process or this practice in your programming and services, and that everyone on staff understands that. Like I said, I don't care, from board to executive leadership to mid-management to whatever layers of hierarchy that you have, from volunteers, whatever, right? You have to make sure that there's community engagement, not just outreach, like here, go here. No, community outreach is just going and leaving your brochure. Community engagement is actually explaining, taking time, building relationship. More to this is to be inclusive, right? Invite culturally specific organizations to meet, discuss the available services, and assess the barriers to services for those communities. Again, as amazing as we are in our own organizations and the services we provide are amazing, we cannot truly be successful in maintaining the safety and the integrity of survivors of sexual assault or gender-based violent crimes without meaningful collaboration with community partners, organizational partners, and what have you. And again, part of this is meeting with culturally specific organizations that are also multilinguistic and saying, hey, our services, we're developing this language access plan. And so we want to meet with you. We want to have a conversation, all those things. And again, build relationships with allies and community. And this has to be reciprocal. Meaningful collaborations. If you're going to start from beginning the development of a language access plan to the way of implementation, you want to make sure that these relationships you're building with culture-specific, multilingual, or multicultural organizations, that is reciprocal. That, you know, perhaps as part of your language access plan, you've included that we have built relationships with these organizations. And especially, let's say you're really trying to enhance your access to community members that use languages of lesser diffusion. Like maybe you are lucky that to identify that there is an organization dedicated to Mixteco, or have or work with communities that speak Mixteco. And you know, maybe that's part of your port of contacts in your language access plan, but it has to be reciprocal. You're not just going to call them when you need them for this and that, and they're not. And if they're going to be part of that process, then you have to compensate accordingly. And again, that is going to be included in your language access plan. Again, when you're trying to inform people, hold community informational workshops, again, as part of your developing your language access plan on topics important to community members. healthy relationships, legal remedies. Again, these are things that you are maybe providing on the regular, but again, you want to make sure that they're also linguistically accessible. Create a public service announcement to be featured on culturally specific radio stations, public access stations, and so on. Again, you have to disseminate, but be ready for that. And be very clear on what you're limited to do. And it's okay. Be very clear to the community partners, communities, like, we provide services in these languages, and this is our process, but currently we're limited to this, and we're building our capacity to extend that. So I'm all about get good at what you do, become amazing at that approach. Don't overextend, because that leads to self-sabotage. Again, if you want to start off with one language and perfect that, like perhaps Spanish, great. Because yes, you may have bilingual Spanish speaking advocates, but again, what is the language access plan? Let's say Maria is out of the office accompanying a survivor to court hearing. Does that mean your services stop because you have other community members who are limited English proficient in Spanish? I mean, only in Spanish, or proficient in Spanish? No, it doesn't. So again, making sure that you have the infrastructure, you have the foundation to do this. Monitoring compliance, as I mentioned before. Now that you have this comprehensive policy and practice to provide meaningful language access to survivors, community members, and so on, you must develop a plan to monitor and evaluate its effectiveness. So part of the plan is, let's say you have the plan, you are implementing it, you've done all these wonderful things, all these steps. So give yourself a time frame. Come back to it and say, okay, so our goal as part of the language access plan was to serve so many people who are limited English proficient in this other language. Great. So look at that. Reassess, reevaluate. What were the challenges? What were the concerns? What went right? What went wrong? And also ask community partners and members, right? And also part of your language access plan, when you do, you're reaching out to either your other community partners, organizational partners, ask them, do y'all have a language access plan? And how is your language access plan going to pair up with our language access plan? Because we need to know. And what are we going to fill in? What are the gaps we're going to have to cover? Because you're still at the floor stage of, well, we hired bilingual or bilingual staff, or we use language line. Okay. But did you know, we know somebody, we know Jose Juan Lara Jr. from the Asian Pacific Institute on Gender-Based Violence. They helped us, they could help you. Kind of that. Because sharing is caring. Monitoring compliance, again, bears repeating, but that is part of the process. Always revamping, reviewing, and updating. Again, looking at, do we need to expand the circle of responsibilities of tasks for this, right? Establish an annual review of your plan. Again, just like any other protocol you would in your organization. Assess the following. As I already mentioned, how well do staff know and implement the language access plan? Okay, it's been a year. Because again, as I remind us, in the work that we do, it's high turnover and all of that. Identify the language access plan's results and impacts. Again, I already mentioned that. Assess the capacity, survivor input, and sustainability. Community feedback, because we cannot do this work without community feedback. Document strategies in progress. Again, part of this is we want to memorialize every success that you have and really highlight that, right, as much as we can, because it's always easy for us to concentrate on the bad, the mistakes. Great. And when that happens, reach out to us and say, okay, let's look at it from a bigger perspective. But really, 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 really kind of celebrate those successes, right? And acknowledge the team members that took the lead on this, and and you trusted their leadership and are building their leadership for this to continue, like really document that and say, this worked, this was amazing, what have you. And it's in the significance and its impact you're having on community, right? Because it will. And if you have this language access plan and it's working and and success is relative, right? And to me, success is, shoot, we really missed the situation, but we are learning and we're improving, and so on. And as people, as community members, especially community participants who are limited English proficient in other languages, they find out that you are culturally responsive and linguistically accessible, they're going to start coming to you all. And, I had this experience when I worked at another organization where, when I worked at Esperanza United, um, you know, we were buying for the Latino communities, and that is in our mission and so on. But then as other community members of other languages realized that we were providing linguistically accessible services, or the organization, they other members like from the Hmong community were starting to access services, which means that, okay, so when you start thinking about planning and developing your language access plan, you have to think about it in the future tense and saying, if we really get good at what we do around linguistically accessible services, word's going to get around. And even though perhaps right now it's Spanish, people are going to start coming to speak Hmong or other languages. So we need to be prepared for that to happen. And the process is the same, y'all. And because you have a language access plan and everyone in that organization is trained on how to follow it, how to do it, what you need to do to contact an interpreter and so on, not a problem. We got it. We got this. It's not going to be perfect, but we got this. And we know what to do. And we're not just reacting, we are responding. Just looking at time. And again, just to summarize everything that we've kind of talked to and, we addressed in the webinar series and just here today, just really thinking about language access is vital to those in trauma. Your language access plan is addressing trauma. When we implement a language access plan, it is also a trauma-informed approach. Because as we've learned, for those of you who've attended the whatever webinar session is part of the series you've attended, the one thing we know is that language access is a trauma-informed approach. Interpretation and translation are more than being bilingual, and the language access plan will give you that format. You will define that as part of your language access plan. Language access planning benefits staff and communities only if there's transparency, training, and feedback. Bears repeating: transparency, training, and feedback. And, when you are interviewing people to join your staff, regardless of what role that may have, whether they're not frontline direct services or they're in the administrative or whatever, you ask them. We serve all community members, regardless of how they identify, also their linguistic ability. And if they're not on board, they don't belong. And again, you have to be explicit. Language access is an ongoing process. It doesn't happen overnight. We're here to help ultimately, right? We are here to help. We are here to help you in this journey of being linguistically accessible, culturally responsive, trauma-informed, all of those things, right? We are here to help. You're not alone. And if you want to blame us, tell your supervisors, well, API said fine. And if you want us to have a conversation with leadership, we'll have a conversation with leadership, right? It's a thought partnership, but there has to be buy-in. There has to be an ongoing process. Otherwise, people will continue not coming to our organizations. People are going to continue to get hurt. And we don't want that. I know none of us want that. So we have come to the end of this particular webinar. So I'm going to open it now for questions. If there's any comments or concerns, I've kind of given you a brief overview of what developing a language access plan is. But I'm going to pause here and just kind of give space for people to ask questions or share some thoughts or what have you.
So if you want to place your questions in the chat box, or if you want to just come off mute, you can do that as well.
I know it's a lot of information. And again, this is what I would do in an individual TA consult with everybody. It's a lot of information to process, but this is what a language access plan is, or planning for a language access plan. Let's see. We have a question, I think. Let's see. The question is, are there any specific funding sources you recommend applying for to support language access services? So yes, so if you apply for any type of state or government or state or federal funding, you already have the funding for it. There a lot of states are now moving to require applicants to include a line item for language access services, so interpretation, translation, and so on. So yeah, you already have the funding. The grants that you apply for, that should be built into the budget in your proposal. It's again, federal mandate says Title VI of the Civil Rights Act of 1964 says that anyone that provides, gets funding, government or state or federal funding, has to provide linguistically accessible services, therefore having a language access plan. Executive Order 13166 further clarified that. So yes, so at the time that you apply for any type of these federal funds, definitely. There's also foundations that as well, right? So again, any type you're applying for any type of funding, built it into your budget already. Which again, if any of you here are decision makers, like upper management or executive directors or whatever, that should be part of your organizational overall budget. And that's where it starts. And people will say, well, you know, it's expensive. Well, we know that transitional housing is one of the top 5 things that a lot of survivors request. And we made it a priority as a movement. And now we have funding for that, right? It's competitive, yes, I know. But unless we make it a priority, it's never going to happen. So again, when you apply for these monies, for these grants, build it into the budget. So state and federal grants, foundations, some foundations will support. Good old-fashioned fundraising as well. And again, from your organizational budget, include that, bake that into your budget. And we can provide some guidance as to how to do that as well. Any other questions?
In relation to the funding available, I particularly know that here on the state, VAWA and the state funders have been encouraging all of the nonprofits around the state. They have received grants from them to absolutely put that as an item in their budgets. Other options are depending, let's say for Spanish, if you really want to increase your language access for the Spanish community, there are the Latino Foundation. Every area in Colorado has a section of the Latino Foundation, or they call it some different ways. I would say, you know, reach out to them, and they usually help provide local agencies with funding specifically for language access. That will be another option. So yeah, looking into those things is really, really important. Cultural specific foundations usually pay for that. Also, the state health foundation also has been encouraging people to, whenever they apply to their funds, to put the line item for language access. So there's a lot of agencies and foundations around the state. They're really concentrated on language access around.
Thank you, Agatha, for that. So reach out to Agatha. She might give you she'll probably give you the resources and all of that to connect with those various funding streams. Any other questions? Okay, another question. How would you suggest we go about identifying entities in the community that may or may not have a language access plan in order to reach out to them and help them develop one or improve, update their current one applicable to the entire country and particularly to Ohio? Oh, yeah. So, so I would say, just for example, let's say starting off with your local municipality or city count or city municipality, I would Google language access plan for the city of whatever, right? And often it'll pop up. It'll give you like if the city of Akron, Ohio has a language access plan. So if you just do a simple Google search, it'll pop up. So like does language access plan for this, language access for plan. Same thing like language access plan for high school so and so. Because again, they have to have language access. Same thing for the hospitals and so on. So it's just a matter of just doing a general Google search and just put language access plan for fill in the blank, and that should pop up. You can also go to lep.gov. It's also a good clearinghouse of information. They have templates of language access plans that you can use as a boilerplate. Thank you, Kathy. Yeah, so it's just a regular Google search, language access plan for, and it should pop up. Also for language access plan for police department, city of whatever, it should pop up. And if it doesn't, might be something to be concerned about. Same thing for court systems. Language access plan for municipal court, whatever. And it may pop up, or it may be just one general one that they have as part of the Office of Court Administration, I should say. So in most judicial jurisdictions, the Office of Court Administration is the one that may have the language access plan, and also explains the protocol for courts to request court certified interpreters in their jurisdictions. Generally speaking, it may vary from jurisdiction to jurisdiction, but just doing a general Google search and you'll find information. And that's what I do when I'm curious about when I've done a call with somebody from a certain community, I will go and Google, say, language access plan for the city of this or whatever. Yeah, because everything's out there. And just ask them, like, if you're in a meeting with a organizational partner, it says, hey, we're developing a language access plan, just wondering if you have one too. And if they say, maybe, like, oh, okay, well, let's have a conversation, right? Kind of those things. So
This is Agatha. I think to add to that, Jose Juan, is the other option is, we in the sexual violence field, and even in both, right? We have the multidisciplinary teams. Having that, adding that to the agenda and a multidisciplinary team, the STARS, CCRs, and all of that, whatever you call it in your state, it's a good starting conversation to say, hey, which ones of you all who are participating in this meeting and are part of the multidisciplinary team have that language access, and then connecting with them after that it's another way that I would suggest that.
yes. And thank you for that reminder. And the other thing I would also do, if I would say contact your local state coalition and ask them, do you have a language access plan? Because one of the areas of experience we've done is we've worked with a lot of coalitions on how to help build their capacity, to build the capacity of their member programs on how to provide linguistically accessible services and develop a language access plan, just like we're here doing with CCASA. So I've done that with Pennsylvania, PCAR, Pennsylvania Coalition Against Rape, I think. I've done that with both coalitions of Mississippi. I've done that with my home state, Texas, with the Sexual Assault Coalition here in Texas, and others I can't remember at this point. But I think if you want to reach out and say, hey, and in some coalitions they actually created a position, access coordinator, as part of the coalition support to their member programs. So reach out to your coalitions and ask them. I can't remember. We've worked with the Ohio Coalition. I don't remember at this point. Maybe one of my other colleagues has, but we have engaged with several of the state coalitions around the country as well. So reach out to them and ask them. And we've helped develop the capacity of coalitions as well. Yeah. Wonderful. Thank you so much. Do you know if private physician offices need or required to have an accent? Oh, the technical answer is yes. If hospitals, for those of you who work with sexual assault survivors, Google the hospital and Google the hospital's language access plan and ask them, what is your process for a survivor to request an interpreter? One thing to note is that there's different kinds of interpreters, and you may know this already, but just bears repeating. There's, remember I mentioned court certified interpreters. There are as well as medical certified interpreters. And so Google the hospitals and Google language access plan for so-and-so hospital. And as part of your sexual assault advocacy, meet with, if you have a connection or relationship with, your local hospitals, especially the forensic nurses, ask them. Also ask the local child advocacy centers and ask and talk to their forensic interviewers. Have you ever had to contract with an interpreter for the forensic interview with a child of, whatever? Ask them that, if you have those relationships. And then like Agata said, if you're part of MDT, multidisciplinary task forces, or coordinated community responses, if you want to invite us to have do a presentation, a webinar on language access, I've done that. I'm currently working with a lot of MDTs or CCRs as well. So we've had, I've had a multiple of experiences with multiple compositions of teams, groups, and everything. But yeah, I would say reach out to your state coalitions and ask them, hey, do we have a language access? Do you all have a provide capacity on how to develop a language access plan? And always bring it up. Bring it up at every meeting that you're part of. Bring it up because it's part of culturally responsive and linguistically accessible services, right? Bring it up. Especially what those homicide review teams. I don't think that's the correct term, but even in those, right? Was there any language access challenges for that victim of homicide? For that, for whatever happened, right? Because there has been some jurisdictions are under consent decree by the Department of Justice because someone died because of failure to provide linguistically accessible services. So if you go to the LEP website, they keep a track of all those jurisdictions that are currently under either consent decree or review. I think that's the other term. So you might want to check out if someone in your jurisdiction is under that right now, right? So again, just Google, call your coalitions. If you want us to do a webinar for your MDTs or CCRs or whatever, glad to do it. Yeah. And every meeting that you have, ask the question. Like, was language access provided? Especially if you are aware that this involved a limited English proficient survivor. It's like, what was the language access like provided for this person? And again, reach out to your forensic nurses, the hospitals, all of that.
This is Sagada again, sorry, but also part of that, one of the things that I understand and know about specific private physicians' offices is that most people, most offices, physician offices, even though they're private, they do get their clientele as part of people who have insurances that, or also government, like Medicaid, Medicare. So they are, but by that, they have to be abiding by the rules of the states and federal government, that they have to provide language access. And the other part of that is if they want to make sure, they should be doing it, because if they want to make sure that the people that they're serving are really understanding what kind of medical services they're receiving, understanding what kind of treatments they are. So I'm not a legally know everything. My sister does works in a private clinic, so I do know that they have to provide services like that. But yeah, like Jose Juan was saying, reach out to those people who work in the medical field, and they will be even more specific about giving you that kind of information. But they do have to, especially if they're getting people who are under Medicaid or Medicare, they have to have language access for those people.
And again, if anyone wants to have an offline conversation, I'll put my email in the chat. It'll also be on the PowerPoint slides I'll be sending to CASA team. But if you just want to have a further conversation, because there's a lot of things that perhaps you all want to share here, but yeah, more than welcome to do so. We're here to support and help as best as we can. Again, it's a process. It's a journey, not a marathon, and I'm just glad to help.
Okay, if we don't have any more questions, we want to thank all of you for attending, and thank Jose Juan for this amazing series of presentations. This is very valuable information, and we look forward to doing this again. And please feel free to reach out to any of us with any questions you might have. And I am putting a survey in the chat right now, so if you would fill that out, and there will be a follow-up email with the presentation slides. And this survey will also be in there with all of our contact information. So please fill out the survey, and thank you again, and reach out with any questions.